Vaginal estrogen is amazing. And I would say almost every woman should be on vaginal estrogen if they're in menopause or even perimenopausal. The issue is you're placing it in your vagina, on your vulva. It gets absorbed locally, so in those tissues. It does not appreciably increase your systemic levels of estrogen. So systemic means throughout your body. So it's not increasing your blood levels of estradiol. There's been studies that have looked at that. Some of the studies, depending on the dose of the vaginal estrogen, there is a small increase in blood levels, but it's short-lived and then it goes back down as your vaginal tissues get thicker because of the vaginal estrogen. There's been studies that have been done looking at vaginal estrogen use in breast cancer survivors that has shown no increase of breast cancer recurrence in breast cancer survivors using vaginal estrogen. There is not any group, there's no increase in blood clot, there's no increase in stroke, there's no increase in anything from vaginal estrogen. The only group of women is, I would say, women who have had breast cancer are on an aromatase inhibitor. So that's a medication that suppresses estrogen levels to below menopausal levels, to where you can't even measure those estrogen levels. But if they're on an aromatase inhibitor and their oncologist feels like for their cancer, they do need their estrogen levels to be at zero. Not all women on an aromatase inhibitor need their levels that low. They're on an aromatase inhibitor because that just makes sense for their situation. If they're menopausal, usually they get an aromatase inhibitor versus tamoxifen.
Okay.
So it's really a subset, a very small subset of women, breast cancer survivors that are on an aromatase inhibitor are questionable. They should talk to their oncologist about it. Everyone else can use vaginal estrogen.
And even those people might say, I'm willing to take the risk for the benefits of vaginal estrogen, which is huge.
Exactly. Those women, every woman deserves a conversation. And we feel strongly about this, about everything, but especially hormone therapy for women. There's no role for doctors to say, I'm not giving you that medication. I'm not even going to talk to you about it. You don't qualify, or you're not. It just doesn't make any sense. Every woman deserves a risk-benefit conversation. And then every woman deserves to make that decision on her own. If you decide as a woman that you understand the risks and benefits and that's what you want to proceed with, then that's what we should do.